like to introduce both Suncha Satney and Tigran Bajgoric from the Community and Social Services Health and Safety Association to discuss mental health injuries in BC's social services sector.
Hi, good morning, everybody, and welcome to our little session here. I'm so impressed with everybody is running on time today, so you're doing an amazing job. My name is Tigran Bajgoric, and I'm the CEO here at the Community Social Services Health and Safety Association. And with me today here is Suncha. Suncha, do you mind just introducing yourself?
Hi, everyone. My name is Suncha, and nice to be here with you this morning. I am a workplace psychological health and safety consultant here at CSSHSA.
And thank you, Suncha. So we're going to just take turns going back and forth between our slide deck. Today, we're talking to you about psychological health and safety and the environmental scan that we did in our sector. I'll also talk a little bit about us so that you have a little bit of a background on what we do and who we are. But before we get started, I just want to say that I'm calling in from the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh people. And as part of our membership, we have a lot of Indigenous organizations and a lot of Indigenous clients. And so our reconciliation is a big part of what we do and integrating that into health and safety programs that we're doing. And we're excited to be here with you today. So a little bit about us. So in BC, we have 13 health and safety associations, and we're the newest ones. I think the other ones have been around for about 10 to 15 years already. Ours is now fully independent since last year. And what that means is basically in BC, every organization and employers are grouped into what's called classification units. And social services and healthcare is sort of one group. And within that subgroup, we have social services is under mainly sort of three units, which is life and job skills training, counseling and social services, and residential social service facilities. So that's a mouthful. Really, what the sector does is we work with harm reduction organizations, we work with life and job skills organizations, we work with organizations that work with children who are in foster care or in, ministries, under the ministry umbrella. We work with organizations that do community living. So there's really a wide variety of services and programs that fall into social service umbrella. It is a bit of a sector, and so we're here to develop resources and tools and education specifically for this sector, tailoring everything to them. There's a ton of health and safety resources out there, so we want to make sure that our stuff is really tailored to the social services sector. And so I'm going to pass the next slide on to Suncha.
Thanks, Tigran. So just a little bit about this study that we do. We call it the environment scan of community social services. Like Tigran mentioned, community social services in BC, it's a very important sector, vital sector, provides several services to the residents of BC, including clinical counseling, supporting in-house persons or persons experiencing homelessness, teaching life skills to persons. However, there's a huge mental health, poor mental health outcomes and mental health toll that comes with the work. And workers are usually impacted due to heavy workloads, just limited resources and exposure to trauma. I was a frontline worker for many years, and that really resonates with me. Burnout is pretty high in the sector, and then there is really a really high turnover in the sector just in general. So the purpose of this study really was to create recommendations for the sector so that we could create content and resources for the sector by partnering with organizations to improve these mental health outcomes. So the environment scan is really the starting of a conversation to see what's working well and to identify psychosocial hazards in the sector and see how members within our membership need support.
Perfect. And sorry, I just realized that maybe, am I sharing the wrong screen? I should be sharing the other one, right? Or do you see, Suncha, do you see the notes or do you not?
I do see the notes, I think.
Okay, let me fix that. Let's go to screen 2. This should be better.
Great. Perfect.
That's the kind of embarrassing. I'm sorry about that. All right. So we use normally a Zoom, and then sometimes we use Teams. So WebEx, we actually have it, but we rarely use it. So in terms of why we did this study is sort of in injury rates in social services are higher than what we see in BC on average, especially in our residential social service classification units. They're about 3 times higher. And what we see a lot more now is sort of the mental injury claims. And in social services, like Suncha says, there's a lot of burnout, there's a lot of trauma because you're dealing with overdoses, you're dealing with all kinds of mental toll on our frontline workers. And so as a result of that, the mental health claims have been, steadily increasing over the last few years. Now it's almost close to what the paramedics are experiencing or the firefighters are experiencing, especially, and as a result of that, WorkSafe BC, which is our regulator, has now basically allowed certain occupations to be pre-approved in a way for mental health claims. So that means that if they're in that specific category, like a social worker working in social services, would actually sort of be streamlined into the claim processing and have faster access to psychological medical services. So what we see is a really high injury rates in certain specific sections of our sector. And as a result of that, and these mental health claims, we're trying to put strategies in place for this sector and working with the different employers and organizations to see what different programs they would need. And so we're looking at best practices out there, as well as what the industry would like to see. So this is our, first kind of, I don't know if we can just do a little poll a little bit. Maybe you can respond in the chat. What comes to mind when you hear the term psychological health and safety? I know we've heard it a few times now, but if you can, in this talk, maybe you can just type in the chat to what comes to mind when you hear that term. And then we can read it out later, and would love to see some of the responses.
Someone said, I can truly be myself at work, psychological well-being. Someone else said toxic stress levels or vice versa.
Yeah. So, thank you. Yeah.
Safe to be yourself.
Perfect. Yeah. So that's we're going to talk a little bit about the definitions as we go along in this presentation. Minimum to no mental harm in the workplace. That's a great term. So next slide is about our psychological health and safety and what the benefits are. So passing it on to Suncha.
Yeah, so in this slide, of course, this slide is not exhaustive. There are so many reasons why psychological health and safety is important. In community social services, it impacts both the worker and the participants of the programs or the clients that we serve. So there is a dual impact there in this sector in BC. So it's really important that we're really focused on prioritizing it and helping persons just have overall better mental health outcomes. But here are some reasons. Again, not exhaustive. Employee well-being, workplace productivity, participant care quality, burnout reduction. Like I said, burnout is really high within the sector. Staff retention, trauma mitigation, legal and ethical responsibility of the organization. It helps improve workplace morale, psychosocial risk prevention, and having a resilient workforce. And as you look at this list, I'm sure some of these resonated with you, some more than others, depending on your situation and your role. But if you can think of other reasons why psychological health and safety is important, you can just put it in the chat and we'll look at it.
Thank you. And then so as we did this environmental scan, so how did we go about it? And, we're not perfect here. We had a lot of things to set up as a first year independent organization, but we really wanted to get a pulse check on the sector. So we hired a consultant, and they work with our team. And together we did a little bit of a literary research to identify best practices and industry trends and risks. And of course, there's a ton of stuff on healthcare oftentimes, but not enough on social services and some of the other industries. And we really did a little bit of a reach out to the sector to identify organizations that would be interested in participating. So we identified some key leaders for interviews as well as workers, and we did the structured conversations with them, and then we did focus groups with the workers in groups. And those were sort of facilitated conversations. We had specific questions we were asking, and then after basically the information was collected, we organized it and provided recommendations based on topics that we saw. And of course, we realized there's a lot of limitations to this. Organizations that reached out they were more likely to be experiencing challenges when it came to psychological health and safety. So there's definitely limitations to our approach here, but it was still a good way to get a pulse check on the industry and understand some of the recommendations that we need to work on and how we're going to set up our psych health and safety program in the future. And Suncha.
Thanks, Tigran. So we have a few definitions here. Psychological safety, psychological health and safety, and hierarchy of controls. Amy Edmondson, a leadership development expert from Harvard Business School, defines psychological safety as felt permission for candor. And I really like this definition, and I use this in my presentations all the time. So candor means being open, honest, and sincere. So felt permission for candor. And Monica in the chat said, you said that psychological health and safety means I can truly be myself at work. And that's what Amy's alluding to here. It's an ability to be able to be yourself and show up, being open, honest, not hiding mistakes, and being open to discuss things and having the safety to do so. I really like that definition. She also has this book called The Fearless Organization. And she mentioned in the book that it's not necessarily about being nice all the time or agreeable all the time. It's about feeling comfortable to speak up, to ask questions, admit mistakes, and to offer new ideas without fear of humiliation or punishment of some sort. And I really like that definition. And of course, we have the official definitions on this slide. The first one here, psychological safety, the absence of harm or threat of harm to mental well-being that a worker might experience. And we have psychological health and safety, a workplace that promotes workers' psychological well-being and actively works to prevent harm to workers' psychological health, including in negligent, reckless, or intentional ways. Another definition we wanted to look at is hierarchy of controls. I'm sure you've seen this, especially if you have a health and safety background. But if not, it's a way of determining which actions will best control exposures. And this concept can also be applied to psych health and safety. So just imagine a ladder. The hierarchy of controls, the higher you go up in the ladder, the more effective the control. So we'll look at it in the next slide a little bit, but the first one being elimination. That's the highest part of the ladder. If you eliminate the risk, it's no longer there, and that's the most effective thing that you can do. But that's not always possible. So yeah, this just shows the psychosocial version of the hierarchy of controls. And I have a little example that I'll share with you to just really, and I really like this example. So you notice on the left here, it shows fix the work at the bottom and fix the work at the top, which really highlights how much the top parts are more effective because you're fixing the work. So eliminate. An example would be in community social services, workers are always or many times exposed to verbal aggression from clients or participants. So eliminating it would be removing that, removing that type of aggression, but that's not always possible to eliminate it completely. So redesigning the work would be another one that could be done, right? Another part of the hierarchy of controls, which would be substitution. So replacing with something less hazardous. Maybe introducing a triage role or reception worker that's trained in conflict de-escalation, or making sure workers are trained in conflict de-escalation would be a form of substitution. The next one is to adjust or engineering controls. That would be to change the physical or organizational environment. For example, install barrier-free safe zones or a panic button, right? So that workers could have that level of safety. The next one would be to educate or administrative controls, policies and training. So implement a debriefing protocol after persons have been exposed to verbal aggression or aggression in general. And the last one is well-being PPE, or traditionally PPE. This was individual supports like offering counseling or peer support or stress management or resiliency or mindfulness programs. So that would be the lowest part of the ladder. And it's interesting that sometimes we push those methods all the time. See a counselor, use your employee assistance program, or here's this resilience training. But it's at the bottom of the ladder. Still important, but it's when it comes to effectiveness, it's at the bottom. I'll pass it on to you, Tigran.
No, okay. Yeah, sure.
Is this me?
Yeah, this one's still you.
Okay, so sorry. So participants in this study identified several strengths. So we had focus groups that we met with. We met with frontline workers. We also met with leaders, executive directors, and the participants were able to identify several strengths of the sector within BC. So I'll just talk about a few of the strengths. So staff and leaders are compassionate and care about the work that they do was one strength. And a lot of persons have the value of wanting to help people. That's another strength that was identified. And some organizations have effective strategies to mitigate psychosocial risks, like debriefing procedures or mentorship for new staff, or check-ins and safe spaces persons can retreat to when they're working the front line. Some organizations are doing that well. Another one is that there are some persons do really thorough onboarding processes to really prepare workers for their role. That was another strength identified by participants. And also some persons have developed lots of skills to maintain their own personal mental health and wellness, regardless of being exposed to psychosocial hazards. They've developed this type of resiliency and strategies that work really well for them. And some also reports supervisors and managers they learned to cope as well. So supportive supervisors and managers, and that had a significant impact on their individual coping of the front line. So having a supportive manager can make all the difference, and some persons identified that as a strength as well. But we did have some risk or areas of growth. I think, Tigran, you'll be addressing that next.
Yeah. So as we went through the study and we interviewed the participants and workers and managers, so they identified a number of risks or hazards. And I think one of the bigger ones that comes up is always under-resourcing in the sector. The sector is often funded by different ministries here in BC. And so I think it falls onto 7 different ministries. And as a result of that, they get targeted funding for specific things. And sometimes a role will be funded by one ministry for half the time and then another ministry for another type of program. And so under-resourcing, like everywhere, is a factor. But I think in social services, it probably is a bigger factor than in other industries, I would say. Uncertainty about what constitutes a self-care plan. As a result of seeing a lot of trauma and death and other sort of emotional tolls, workers would really benefit from a self-care plan. And oftentimes they don't necessarily have their own self-care plan in place, even though you're doing this type of work that has a high emotional toll. There's, of course, difficulty working with vulnerable populations, and managing your own mental health and substance use concerns can be a factor. Oftentimes we hire people into the industry that have been previously homeless or been had substance use disorders. We know that there's a high limited knowledge on burnout prevention within the sector. So we've been doing initiatives to talk about burnout and what it means and mental health in general. There's working alone concerns that come up. So there's a number of sort of hazards that the group identified that pose a risks to their organizations or industry as a whole. Like I said, from the overdose crisis, we've had a high exposure to deaths, and that is oftentimes a big factor in terms of the trauma and vicarious trauma that they experience on the job. And so those are, they also had some participant suggested improvements. So now we're going to talk a little bit about the recommendations that the sector had for us, or the people that we interviewed had for us. So in this case, I'll pass it over to Suncha.
Thanks, Tigran. So participants had some general recommendations for us in this study. The first one being to improve screening by ensuring people know what they're getting into, because one of the issues is that they felt like workers did not know the level of intensity or the mental toll the position would have. So they're going thinking one thing and come out being like, oh, I didn't know. So having a more thorough screening process and onboarding process was one suggestion. And also making sure everyone has access to mental health care. So create universal access for the industry, because some persons had really good benefits and others didn't. Another one was to create a small refuge areas in high hazard work areas where workers can retreat, regroup and recharge, a safe area persons can go to and kind of like unwind, take a pause, and just really like take some time for themselves when they're in that type of frontline work. And also building clinical supervision, not all direct service employees have professional associations that provide access to clinical supervision. So for example, clinical counselors would have, but some frontline workers like youth workers wouldn't. So they thought it would be valuable for persons on the front line to have some sort of supervision built into their role. So those were some of the suggestions that we got from them.
So one of the things that we as a provincial association are doing is also really trying to advocate for the sector, and we do that by building partnerships. It could be partnership with our regulators. It could be partnership with the ministries. There's a number of agencies within the sector that focus on specific areas. For example, Federation of Social Services, what they do is they focus specifically on the children and youth part of the sector. There's a community living association that focuses on housing. So we collaborate with all of these different associations and regulators. We also collaborate with health and safety committees from the different organizations. We promote peer support programs. And we have a community of practice that brings in together health and safety professionals and other industry experts to kind of guide us and help us with our work to ensure that we find recommendations and solutions that really work for the sector. And then next recommendations was around tools and resources. So
okay, so this was another recommendation that we had when it comes to tools and resources, and we're already working on, like Tigran said, we're working on this actively. One of the recommendations was to explore options for access to quality mental health care for all workers who are exposed to psychological risk. Like I said, not everybody has the same level of benefits in the sector. Another one was to develop a toolbox of resources that everyone can access relating to psychological health and safety, and to support integration into existing health and safety management systems. So working really closely with joint occupational health and safety committees to see how they could implement psych health and safety within what they're already doing. Also research evidence-based best practices. Another one that I thought was interesting, because I'm a clinical counselor, is to develop healthcare provider directory of occupationally aware clinicians. So where frontline workers will be able to access clinicians that are occupationally aware, right, after they've experienced an injury, something we're working on as well. Develop training for supervisors on psych health and safety, and provide a learning forum on key psych health and safety topics. We're also collaborating with CMHA on some of this to provide training for frontline staff and also supervisors in the sector.
Finally, what we're doing is we have a number of ways that we're reaching the sector. And so we have our own webinars. We do about 12 a year. We have a regular e-newsletter that goes out to organizations a couple of times a month. I already mentioned our community of practice. We also have an updated website now that we just added some courses to, which I think the online courses are all free for our members. And we have a number of in-person courses now that we offer. So all of that has been put together really fast, I would say, as we try to support the sector to do this important work, to reduce the number of mental health claims, to reduce the number of the injuries that we have in terms of violence and MSI and slip and trip and falls are those three also main types of injuries that we see in the sector. And so just wanted to wrap it up here. So thank you very much. If you have any questions, we're here to answer them.
Great, thank you. So far, I don't see any questions. I'll give it a few minutes. So and please, again, just a reminder to fill out the Slido questionnaire that should be popping up any second now. It'll really help us out.
I thought I would pop on and ask my question verbally. Thanks very much for sharing all the great work you guys are doing. It's very impressive how quickly you're gearing up and into this, this area, as well as the sort of more traditional health and safety. I'm interested in your comment around the territorial land acknowledgement, and I'm wondering about indigenous, like, products for
Sorry, I lost you, Valerie. I love it.
Sorry, maybe you can't hear me. I see that I'm having internet difficulties here.
You're back now.
Yeah, you're back.
I'm going to turn off my video. Sorry, I'm in a hotel room in Scotland. It's not working off my phone.
Yeah, so go ahead.
No, it was just the diversity of populations, and then the support to those populations, that multilingual resources and multi-level resources, and that resonate with those communities must be an important aspect of this work, I would think.
Yeah, I would say that it is so for personally myself, I spent 10 years in healthcare. I worked for the different health authorities and did health and safety programming there. And I was not necessarily, I would say I'm still learning about social services sector. And as I'm new to this sector, and yet in healthcare, I work very closely with many of those organizations, and I didn't necessarily realize how important role the social services sector plays in the well-being of all workers, really, that work in various organizations. Because they provide job skills and training, they provide mental health resources, they provide counseling, they provide so many different services to all kinds of clients in the province. And so I think the sector is very unique, and it does feel oftentimes like their work is undervalued. And as a result of that, I think it is like underfunded, I think. And oftentimes I think there's so much great work happening in this sector. So I think I wanted to talk so it is important to us that we tailor things specifically to this sector with examples, and make sure that the training that we put out there, the resources, really speak to the social services specifically. Because if you wanted to have general stuff, there's a ton of stuff on WorkSafe BC's website and forums and things like that. So we do work with a number of Indigenous organizations, and last year we added reconciliation as a value to our or a strategic plan. And I think this work is still in progress. What we did is we applied for some funding from WorksABC to look at how we can incorporate Indigenous style governance into our programming. And I can't necessarily say that I've started this work, but we did get confirmed last week for the funding. And the first phase will be really doing some literature review. Our board chair has actually created an MBA program at the University of Victoria for advanced reconciliation. So that is really interesting. And I think he's helping us drive this work forward quite a bit. This year was the first cohort of that program. And so there's a lot of like graduates that did mini projects that keeps driving the reconciliation work here in BC. And I think this type of work is really active here in British Columbia. So I'm really glad that we as an organization can take this work on. And so as a result of that, we're working with the BC Aboriginal Friendship Centers, which are across BC. There's a number of them. And other organizations so that we can support the great work. And I'm glad that many of them have taken up our resources and training already, and we're building those relationships. So I don't know if I've answered your question, but I hope.
Yeah, yes, very much so. And I think, I guess I'm saying I applaud the leadership in that area as well as all the rest of it, of the organization and the inclusivity of your efforts, I would say, and hopefully they will resonate in getting being able to listen and then provide the tools and resources or partnerships and connections that will help all the different groups. So we don't have any other questions. It's a bit of a quiet day in the chat. I don't know. And we kind of went east to west, and it, of course, changed time zones all along the way, with people coming and going in terms of their day, and when it's lunch hour and when it's breakfast time and all that. So we really appreciate that in terms of, and literally, Kim, you're still here, and Tigran and Suncha from coast to coast, and we have Daryl leading us in Ontario, which is good, and many other people here from Ontario and other provinces. This was just an attempt, I think, that we should do every year when we do this event to just find out what is happening across the country, because we can learn so much from each other and we can tap into each other's resources, but then do a little bit of a focus shift in terms of how it might apply or be beneficial in our own province or within communities within our own province. So I don't know if anybody has any questions. We can unmute the mics if anyone wants to put their hand up and ask Kim, Tigran, or Suncha any questions. Tony, you can unmute, but I don't see any hands. There's a hand feature. But otherwise, I think most people are ready for lunch, and probably Tigran and Suncha are ready for the rest of their day. We normally at this time ask the speakers if they have any last comments related to today's discussion. Is pretty broad but around how we're solving workplace mental health problems or challenges and trying to prevent harm and injury across the country, and finding the tools and resources and partnerships that we can. So hopefully even today's discussion can foster partnerships too, and understanding. So Kim, did you have anything you wanted to add from Newfoundland about your project or efforts?
Sorry, my camera turned itself off and went to sleep. No, I don't think so. It was really great, actually, as you said, to get to see what's happening across the country, and to sort of hear where things are, both from a practitioner perspective, but also from a research perspective. And I really enjoyed the conversation today.
Right, thanks. Daryl, how about you? Anything from Ontario that you can think of, or from recently back from the COPSUC conference in terms of international perspective on this work?
No, nothing too much more to add, but it looks like, things are picking up in different countries and, especially up the COPSOC network. It was very interesting to see all the, new countries that are getting involved in different legislation that's starting to push initiatives. And I think, a lot's happening in Canada, and it's nice that we can come together and collaborate like this and foster some new ideas and work together instead of in separate silos.
Great, thanks a lot. And Tigran and Suncha, anything else you want to add today about your efforts and about sort of across Canada workplace mental health prevention efforts?
Just want to say thank you for inviting us to this webinar, and it's been great to really hear across what's going on across the country, and it's always great to share and learn from each other, so we really appreciate you inviting us to this event.
Great. Thanks, everybody. I really appreciate your attendance today, and at all 5 sessions. Many people have been repeats all through the month, and we look forward to this event every year, and hopefully we'll be running it again starting May 1st, 2026. And we'll have new accomplishments to share and new research to try and mobilize, and hopefully we can forge new partnerships too. So thanks again, and have a safe and healthy weekend, summer, and year. We'll see you next year, if not before. Thanks again, everybody. And of course, the video will render right away on YouTube if you want to share it, and the playlist of the individual sessions will be posted early next week along with the slides. Thanks.